Welcome to the Coping Podcast, where we share strategies for coping with the stressors of life, especially the difficulties of parenting. And here is your host, Dr. Lee Weiss.
This is Dr. Lee Weiss. I am the host of the Coping Podcast, where I feature top experts on topics like raising healthy children, parenting, and so much more. Past guests include therapist and researcher Dr. Ellie Leibowitz, dietitian Lara Field, and many more. Just a quick disclaimer, the information provided is for educational and informational purposes only. This is not intended to provide mental health treatment and does not constitute a client-therapist relationship. The information provided is not a replacement for being assessed and evaluated by a licensed professional and is not intended to replace mental health or medical advice. Before we get into today's topic, I wanted to introduce our guest, Kelsey Mora. I'm so excited to have you here. Kelsey Mora is a dual certified child life specialist and licensed clinical professional counselor based in the Chicagoland area. She worked in the pediatric intensive care unit for almost a decade, where she co-chaired the system-wide perinatal and pediatric bereavement council. Kelsey has been working in private practice for 9 years before opening her own business at the start of 2024. Currently at Kelsey Mora PLLC, she provides clinical and consulting services for kids, teens, and parents impacted by medical illness, injury, grief, and loss. Kelsey is a registered Wonders and Worries provider and part of the Food Allergy Counselor Network. Kelsey is the Chief Clinical Officer of Pickles Group, a nonprofit organization that provides free support and resources to kids and teens impacted by their parents' cancer. And she recently published the DOT Method, an interactive tool to teach kids about cancer. And I've got the workbook here, and we'll talk about that later in this interview. So thank you so much, Kelsey, for being here. We have spoken a little bit about your area of expertise, which is so important. And while I hope that none of our listeners have to be in a situation that will warrant your expertise, I'm really glad to know you're here for when these really difficult situations come about. I know that when someone is really sick with an illness or a terminal illness, we often really struggle to name and identify with language that's appropriate, how to even talk about this with kiddos. So I'm really glad that you're here to help us with that. Can you start by telling us a little bit about how you first got into this work and how you decided to do this type of work?
Yeah, of course. First of all, thank you so much for having me. And I'll add, I know there's a lot of parents listening, and I think a lot of the tips and tools that I share are applicable for even some of the more minor medical experiences and procedures that, I was just with my neighbors, and her daughter had a procedure. And she's like, I went and looked at your tips to help me prepare her for it. So, I think there's takeaway regardless of the severity of situations. And to talk a little bit more about how I got into the field, I was a teenager whose friend had leukemia. And so I was, visiting him in the hospital and navigating that experience as a young, I guess, adult or late adolescent. And I was actually with him when he died at the hospital. And so I had a pretty impactful experience as a teenager and started volunteering where he was treated and learned about the child life profession. I immediately, searched for colleges that had the child life expertise and really found my passion and my dream job in his memory. And it's really taken a lot of different turns and directions along the way, which has landed me here, which, I never expected it in all the ways that I'm, operating as a child life specialist and now therapist.
Wow, that's that's incredible. I'm shocked to hear. I didn't know that last part, that you were actually in the room with him when he passed away. I mean, that must have been incredibly hard as a 16-year-old. I can't even imagine. Was that done thoughtfully, like purposefully, like to be there in his final moments, or how did that all?
No, so I was actually really scared to visit him in the hospital. I
Yeah.
just kept saying, I don't want to remember him like that. And one of my friends encouraged me to go. And while I was there, he died as his heart rate changed, and they rushed me out of the room. I was a teenager. I was like all alone in the hallway,
Oh,
and his family brought me back in at the end, and I was able to have some, meaningful experiences there, but it was definitely difficult and unexpected. And so, I really didn't want other teenagers or kids to go through something like I went through without support. And so really created my whole career and profession on helping kids and teenagers in difficult moments such as cancer, illness, and grief.
Wow. Unbelievable. Um, Thank you for sharing all that. What would you say are the most common questions that you get from parents who are themselves diagnosed with and fighting cancer in terms of like what they're worried about as it pertains to parenting?
Yeah, a lot of things. I think so much is coming at parents when they first get a diagnosis, and yet most parents are just thinking, what about my kids? What am I going to tell them? Do I have to tell them? What are they going to see, experience? What language should I use? I don't want them to be scared. And I think a big one that I get is, I have to be strong for my kids. And a lot of times, I'm talking to parents about what being strong actually means. I think there's a misconception that being strong means like not talking about it or not showing your feelings. And in fact, it can be really important and empowering for kids to know that, it's okay to feel sad. It's okay to also feel happy at moments when difficult things are happening and that we can go through this together. So a lot of times just addressing those fears and coaching parents on what they can say. You don't have any control over getting that diagnosis, but you can control how supported your kids feel and what you tell them.
Wow. Yeah. Yeah. No, I mean, there's so much to wrestle with. And obviously different levels of severity and prognosis, impact the language and the tone and all of that too, I'm sure.
Definitely, yeah, and the age of the child and, yeah, just the situation. Sometimes it's sudden and a parent is hospitalized and there's a traumatic medical event at home. Sometimes it's, there's series of testing that takes place before information comes in. So those experiences can look really different from child to family to family.
Yeah. And so you typically would, consult with the parents and really, again, understand all these different variables to help them in terms of how they communicate all of this with their child.
Yeah. Yeah. I often try to help parents slow down a little bit and start with like what's happening right now, what's right in front of that child. And then those conversations can build on themselves over time. I think it can
Yeah.
be really overwhelming to feel like you have to cover everything in one conversation, but that's, not what kids need. They just need kind of bite-sized information and to understand what's happening right in front of them.
Right. Oh, absolutely. Talk about overwhelming, 100%. Um,
Yeah.
Maybe you can share a little bit about, I know you mentioned your really dear friend who was diagnosed with breast cancer a few years back and kind of how you coached her to talk to her own children about cancer.
Yeah. So my friend Laura, it was 2020 and she was diagnosed with breast cancer. It was like just about a week after I had had my first child. And I remember I got the text from her and was completely shocked. It was August of 2020. And so, middle of the pandemic, and she had two young boys and was like, I don't know what to say to them. She was a nurse, a mom, and she didn't have the words. In that moment, she was hurting and grieving and facing so much. At the time, I had just established my resource, the dot method, but it was just a document on my computer. And so I told her, I have this resource that I'm working on. I'm happy to send it to you and let you, play around with it and use it. And so I did. I emailed it to her. She printed it and used it. There's a picture of her son using it from then, and he's now much older and doing really well. But it's essentially a body outline where kids learn about the cells, the healthy cells and the cancer cells, and they cross them out and talk about treatment and side effects. And it walks them through the whole process in a hands-on, child-friendly way. So she used that tool, and it really helped her kids. It gives you the words, but it's also hands-on, playful, and interactive.
I should just show everyone. So this is the workbook, the dot method. And I was saying to Kelsey before we started recording, it's really in a lot of ways like simple to use, right? It's user friendly. And you can see these pages are really user friendly, but it's not cookie cutter, right? You can make it meaningful to your own experience based on what age, what experience, if it's, chemo versus, radiation, all the different choices versus the surgery. It's really
Mhm.
an amazing resource. I'm sorry again that you have had to use this with your dear friend, but I'm glad to hear she's doing okay now.
Yeah. Yeah, and I think that's, being able to customize it. And now, actually, now that the workbook it's actually dedicated to her family. So it's dedicated to the Welker family, and they now have gotten to see it and do it again. And the oldest, was reflecting on his experience, like, yeah, I basically just put these like dots on a body, and it's so simple, but I learned so much. And he was really talking about how it could help other kids, but even just putting the sick cells or the cancer cells in the location of the cancer. So in their case, they were putting them on the chest or on the breast and learning about, the body parts and where the cancer is taking place. And if it's a mom who's going to get a mastectomy, then it's easier to understand why they're going to take the breast away, because they're going to get rid of the cancer cells. And so, again, these concepts are so complicated, and yet this approach really helps to simplify it in a way that can feel more approachable for parents and kids.
Yeah, and empowering. Again, like you feel somewhat more in control when you're able to like have this visual and draw it. And, I can imagine just
Yeah.
sucking that cancer out. And like, it feels
Yeah.
good to, obviously we don't really have control, but it feels empowering in that way for
For
sure.
sure, yeah, the kids, like, crossing out the dots is really therapeutic,
Yeah.
and making sense. I just worked with a 3-year-old who's struggling with hair loss, and so we put a bunch of the healthy cells on the head and then talked about how the chemo's, getting rid of those healthy cells, which includes the hair, and it will grow back, but that's why that happens. A lot of people, a lot of kids don't understand why those things happen, or why,
Mm.
normally medicine makes me feel better. This medicine makes me feel horrible. Why? It's like, well, it's getting rid of those healthy cells. It's so, so strong.
Yeah.
And, it's helping.
Yeah. I worked back in my training at John Stroger Hospital of Cook County in the pediatric oncology unit. And I could have really used this because just those exact kinds of questions would come up a lot. This was obviously for the kids who were sick themselves, but yes, when the hair is falling out, when they are lethargic, to understand why in this visual way is really helpful.
Mhm.
Um, can you tell us a little bit about, maybe a family you've helped where, yeah, like a little bit more in depth, where a child was diagnosed with cancer as opposed to the grown up, and how you like what kind of language you would use? Maybe someone as young as 3 to 5 age range.
Yeah. Yeah. So, I mean, I would use similar language. I always encourage parents to use the language that they're comfortable with. I want to meet them where they're at. A lot of parents fear the C word, the cancer word. And often I'll tell parents, the risk is that someone else may use that word. And we do want kids to hear it from their most trusted adults. But with really young kids, there is a way to use this approach without using the word cancer. We can talk about sick cells and healthy cells, or bad cells and good cells. And so I have had some really young kids that have used that language.
Yeah.
And then or even the colors. So in the workbook, they pick the colors. So then they're talking about maybe pink cells and blue cells or something like that, and, finding their own language. But um, it's so empowering for these kiddos who are going through the treatment themselves. They've got, a port, or, on their chest where they get the chemo. And so being able to like draw that on the body in the workbook, or design the hospital, or where surgeries take place, and, not be the patient, but be acting more as like the provider, by drawing and creating, can be really therapeutic. And there's just so many ways to modify the book. I've used it with like dot markers. I've used it with pom poms. I've used it with pipe cleaners and stickers. And so it's so customizable. And so that's, when you're asking, about the age or who has the cancer, it can just look so different for every family. And so, yeah, I'm thinking of a lot of 3-year-olds that I've used this with, where we're doing a lot of hands-on work and kind of figuring out what their language is.
Yeah.
There's also a section in the book about feelings, so the kids can draw like faces that match how they feel, and so they'll draw like a happy face and talk about feeling happy and how it's okay to feel happy sometimes, but then also sad or scared. Especially for siblings, that can be really impactful if they're a sibling of a child with
Right.
cancer.
Right, they think they're supposed to be sad all of the time throughout this treatment, if they have it, or if their sibling has it, or their parent has it. And of course, they're allowed to be kids and have normal, happy moments where they're not thinking about the cancer. But it sounds
Hmm.
like you do a lot of normalizing all the emotions that you might feel, and that
Yeah.
there is no right or wrong way to feel.
Yeah. Yeah, and I mean, I used to just take like I still do this sometimes, take like a big piece of paper, and I've even done like body tracings where we're
Yep,
doing the
that's
dot method
that's
portion
what
of
I
the
do a lot.
workbook.
Yep.
Yeah,
It's
there's so
helpful.
many
Where do you
ways to
feel
use
things in
that.
your body? Yeah. Will you show
Absolutely.
everybody the page that you showed me with the port that you made out of?
Yeah.
Forget what art thing you used. Yes. So
Yeah. So
I
we
thought
used
this
a
was really neat.
the port, and then the pipe cleaner is like the IV tubing, and then here's the chemo up here. And so, this there's treatment was green, and so we used a green pipe cleaner, and then you can see it's crossing out, the cancer. For this child, it was a tumor on their kidney, and then they were grappling with hair loss. So
Yeah. It's amazing. Yeah. Again, such a neat way to do it. It reminds me a lot of play therapy and art therapy that we use, of course, with children all the time when they're going through something that, it's sometimes it's too hard to say, I'm going through this, but with little dolls or figurines, we kind of enact, have them act out what's happening. And
mhm.
it's a similar concept. Yeah.
Yeah. I had one child who was really into emojis. Emojis are really
They're
exciting for kids.
popular.
And so, yeah, so she was actually wanting to use emojis on all the pages. So with the feeling face page, she used like specific emojis. And then there's a page for side effects. We were actually working virtually. So I would share my screen with like Google images of emojis, and she'd pick like, oh, I like that throw up emoji. Like I'm going to put that on the side effects page because my dad would throw up a lot, or,
Oh,
the really tired one. And so using a lot of those emojis. And then it talks about coping skills. So on the coping skills page, she found an emoji of someone like meditating, because she would use
oh,
meditation with her mom when she was upset. So like those like unique ways that kids are like, yeah, I want to use emojis. I'm like, great, let's do it. Can be so cool. It's like it's yours. It's your little workbook.
yeah. No, it's again really powerful just to kind of hear how you're utilizing this in different ways. What would you say for parents who know they have terminal cancer? I know that I have several adult clients where this is like their fear in life. They don't even have an illness, but their fear is, what if I die before my time, and I have kids who need me. What Tell us a little bit about the work you've done with parents who are in that stage, and obviously
Mhm.
how it differs from the kids who are being coached to kind of understand what the treatment is, but we assume the parents will actually be survivors.
Yeah. Yeah. I mean, I actually work with a lot of different prognoses and outcomes, and of course, there's so much unknown and uncertainty that comes with a cancer diagnosis and to begin with. And so, for the purposes of the resource, I've actually incorporated a page where I talk about, we all share the same goal of getting rid of the cancer cells. When that's not possible, we might focus on, keeping them small, keeping them calm, like having good days. So I do incorporate that for kids whose experience is uncertain or unclear. But I think the big thing is like starting those conversations earlier, um, so that if we're starting to talk to kids at the time of a diagnosis, we can build on those conversations rather than waiting till there's a big change in prognosis or a recurrence, and then we're sitting down and having to talk about everything all at once. That can be so hard for parents and for kids. And so I really talk about starting early and starting small with like bite-sized conversations, and then you can build on it over time. If you've had a whole conversation about cancer cells and how treatment works, you can go back and say, I have some hard news, or I have some sad news. The treatment's not working. It's not getting rid of those cancer cells. That means that I will die, right? And it's a really hard conversation, but you're not starting from zero. You're starting from, remember, we talked about those cancer cells and we talked about the treatment. And then I always recommend that warning sign of like, I have some sad news to tell you. And then kind of, getting into the honesty of what's happening. Sometimes that's not possible to start early, and that's okay too. But again, you want to start small and simple, and just talk about what's right in front of them, what they need to know.
Wow. Yeah. Wow. And I know they do have typically child life specialists like in the hospital too, but it's really nice that you don't have to wait till you're in a hospital setting to get this information. If you're, earlier diagnosis or not at that stage, that you can actually consult with you about these things.
Yeah, yeah, and as a previous hospital-based child life specialist, the landscape is tricky. There are times when a family doesn't meet a child life specialist, or the interaction is maybe brief, or it's focused on like a procedure, and then they, don't have the time and the space to really dig into these deeper conversations. And so, a lot of child life teams have requested copies of the dot method, or I consult in my private practice. I consult a lot with home based child life teams, so I might work with the child at home. And then I'm telling the child life specialist, like, here's the coping plan we came up with for their port access. There is actually very limited child life support for children who have a parent with cancer.
Right.
We would get paged a lot to the adult side, and we just weren't able to engage in the way that we would have liked. And so so this, again, the workbook is available for all cancer experiences, but I'm also the chief clinical officer of Pickles Group, which you mentioned at the beginning. And that's a free nonprofit organization. I do a lot of talks on how to talk to kids about cancer. We have, many free resources, and then youth groups for the kids. So kids to meet other kids who have a parent with cancer. So that's really trying to fill that gap
Yeah.
when, a parent is in the hospital and there's not a child life specialist, so there's not a dedicated social worker for that need and that question. They can be provided with Pickles Group resources as well.
Amazing. Can you tell us a little bit more in depth about working with a child who had cancer or has cancer? And in terms of, like you said, there's pain management techniques that you'll do with them. But addressing again, if it is in a not so good stage, addressing just missing school and normal child kind of things, kind of get a little bit more in depth just so we can get a sense of that kind of work too.
Yeah. Wow. Yeah, there's a lot. So I think obviously explaining the diagnosis is so helpful so that kids understand why things are happening. Why am I tired? Why am I missing school? Why do I have to go to clinic? Why do I have a port? Or why does my sister have a port? All of those questions. And then so much is like validating the feelings that come with that. I think parents really struggle with typical child development and parenting when a child has cancer. Like suddenly bedtime is really hard, or there's challenging or concerning behaviors happening. And so the more we can I coach parents a lot on trying to maintain some of that typical child development routine, structure, discipline, even just to provide a sense of control, because things feel completely out of control, chaotic, unpredictable, and kids need that structure, but parents do as well.
Mhm.
I always hope that there will be a time when we're not so overwhelmed with cancer, that things are better for regardless of what outcome. And so if we get too far from what's normal, it can be really hard to restore that. And so trying to coach parents on how to find that balance of, nurturing and supporting their child, but also maintaining some of that normal growth and development. So we do a lot of that. I think the pain management piece is coping with, procedures and hospitalizations and side effects, helping empower kids with their own story for navigating like peer interactions. How do I talk to my friends about this when I do go to school? Why I'm losing my hair, or why I wear a mask, or you know, um, why I don't feel good, or things like that. For siblings as well. There's a lot that
Mhm.
goes into this, and some of it is addressed at the hospital, but so much happens at home. I was just working with a young child who was really struggling with like bath time because they had an incision from their surgery and a port, and we had to work up some comfort and understanding just about bath, because the parents were like, bath was her favorite thing before this, and it's like, well, her body is so different now. And so um, there's a lot food eating, sleeping, just a lot of changes that can happen.
Yeah. Can you give us an example of a method for the pain management? Like, is it more visualization, or what kind of things like almost as though you're doing, what would you do
Yeah.
in the hospital with a child, or I guess prep the child for this in advance?
Yeah. Yeah. And so this
Because
is
like
probably
you
like
said, there's medical treatments, in addition, hopefully more benign, that
yeah.
kids struggle with. So I would love to hear more about this too.
Yeah, absolutely. So I try to work on like establishing what I call a coping plan. And so we always want to prepare kids for what to expect, using age appropriate information. I have an Instagram page, Child Life Therapist, where every Monday I post like how to teach kids about something. And so today it was how to teach kids about CT scans.
Oh,
Um, Last week was a spinal tap or lumbar puncture, which is a common cancer procedure. And so a lot of it is preparing the child. Um, what pain management strategies are possible. So for like a blood draw, let's say, I'll do one that's maybe more
yeah. I was
common, or,
thinking
or a,
that's
a
pretty,
vaccine, a shot.
yeah.
Um, yeah, like there's numbing creams, there's a Buzzy Bee, there's like a shot blocker. Some of these things are available on like Amazon. Some
I
are more
saw that
expensive than
Buzzy Bee
others.
recently by
Yeah.
our colleague. Yes.
Yeah, and then comfort holds. So, sometimes you go to the pediatrician. Like I'm a really strong advocate as a child life specialist and a mom that, like, if I'm told to like hold my child down, a lot of times I'm like, wait a minute, like I think we can find a more comfortable position. If kids can be upright, that's always better. We obviously want things to be safe. We don't want to compromise, the comfort of the provider, but certainly like upright is always better. And then, preparing the child,
Upright
sitting
meaning
in a
you're saying sometimes a pediatrician in a procedure would say like hold the child down, like horizontally. Oh, I never
yeah,
heard that
like
before.
even just a baby, like put them down, if I can have my child on my lap, like I feel very comfortable with that position. And if I
Yes.
can like hold them and keep them
Yes.
from grabbing things or wiggling,
And they
not every
feel less
parent feels
vulnerable, I'm
comfortable.
sure.
Yeah, yeah, just like that laying down position is very, very extra frightening. And then distraction and relaxation techniques. So, sometimes it's distraction where we're trying to get their mind off of it, like using a show or using a toy or using bubbles. Um, Sometimes it's actually like more mindfulness strategy. So, I talk about the difference between taking their mind off of it and turning their mind into something more helpful. So, of course, deep breathing, visualization, or guided imagery. Sometimes with younger kids, we'll talk about, imagining your favorite place or like a fantasy land, rainbows, unicorns, like close our eyes, let's use all five senses, taking deep breaths, co-regulation, all of those strategies that we use in everyday parenting, but really applying it in that stressful situation.
Yeah.
And then facilitating recovery, helping them recover afterwards. It's normal for a kid to cry. So like, if it's not like about like, don't cry or, we really just want them to feel like it's okay to cry, you're trying so hard to hold still. Like, even if the procedure was a disaster, we still want them to feel like they did a good job because it is scary and it is hard. So,
Cool.
yeah. I talk a lot about just kind of like setting up and then, the during support and the recovery, but giving kids a lot of choices. Like, do you want to, hold my this hand or this hand? Do you want to look? And a lot of people say don't look. Some kids want to watch. So that's like a
Wow.
reasonable choice too.
Right.
Do you want to watch
Oh,
or look away?
right. Oh, I love that. Again, you're empowering them in any way you possibly can, it sounds like. Um,
Yeah.
how do you decide between distraction and, like you said, kind of like using the senses and really being mindful? How do you know which call is correct in each situation?
Yeah, I mean, I think a lot of it is assessment, and child life specialists are amazing. I mean, I am one, but I I feel strongly about the field, but it's a misunderstood field. A lot of people think it's kind of like, more about playing, but the play is so purposeful. So, like iPads are sometimes used in the hospital, and you'll have the child life specialist walking in with the iPad, and sometimes people make inadvertent comments like, "Oh, thank goodness the iPad is here," and it's like, no, like the professional is here. I'm just using an iPad. So I think it's like, assessing what the child needs. Sometimes you notice that a child is like not distractible because their stress response is so incredibly high that they can't actually engage in a toy. And so that's when I'm like, okay, let's pause. Like, let's take a deep breath. I'm right here with you. Like, I've got you. Mom's going to hold you. Whatever we can do to like reduce the noise in the room, both physically and figuratively. Sometimes, you're blowing bubbles and then everyone's like, wow, look at the bubbles. And suddenly you have like 10 people talking and it's super overwhelming. And so just like reading the room and I always say to parents, like, you know your child best. So trying to figure out what's going to be most helpful for them. Sometimes we have to stop giving choices because if a child's not cooperating, it's like, okay, it's time for the poke now. Like the poke's not an option. You could choose this or this. And if you're not choosing, like I have to choose for you. So I do
Right, like,
set a
if
lot
you're
of
like, "Do you wanna
limits.
hold my" "Do you wanna hold my hand or do you wanna hold, the stuffed animal or something?" And they're, like, spending hours deciding, the anxiety's building and building, at some point, you just
Right.
do what you're saying, of course.
Yeah, like, okay, it seems like you're not in a place to make choices. Like, I'm gonna choose for you. I'm gonna
Thank
help
you.
you get through this. The poke is not a choice. Like, I'm right here with you. So we do have to set limits. I think we try as much as we can to like empower kids. And when at the end of the day, sometimes we just have to get through it. But we just want to try to make it as minimally like invasive and traumatic as possible. And also parents, no, reducing your own anxiety and stress response because so much of kids anxiety is in reaction to a parent's anxiety, so taking your own deep breaths,
Right,
so that you can be your child's best support.
right, staying as calm as you can under the circumstances in the room with them.
Yeah.
Yeah, yeah.
Yeah.
Oh my gosh, which again is like we're asking so much of parents. I mean, considering
Yeah.
how how emotional this must feel to be in the room with with your child who's going through this procedure. But you're absolutely right. They read you and they look to you. Am I okay? Are you okay? Am I
Yeah.
okay? To self.
Yeah, and so, like, sometimes it's the child life specialist that ends up being the person, like, holding the child or talking to the child, and they'll just validate, "Mom's crying because she loves you so much, and this is really hard, but I'm right here with you." Sometimes we just have to step in and support both the parent and the child.
Oh,
So it just depends on the family.
oh, unbelievable. I mean, it's just so emotional thinking about this topic. Honestly, it's really we're blessed that we have you doing this type of work because I don't know that many people who are like, this is my life's dream to be in the hardest moments. And you really are, but it's also probably really fulfilling because you're also really helping people in this deep, meaningful, impactful way. How does it
Yeah.
feel for you when you're, in these moments with these families?
Yeah, I mean, that has always kind of been my motto is like I can't control the situation either, but I can control like helping and supporting a family. I used to always say like trying to make difficult moments into better memories. I mean, I was in the pediatric ICU for almost a decade and was really alongside extremely hard moments for families, including both like acute and critical illness as well as end of life support. And it was amazing. I loved it. I didn't leave the hospital because I didn't love it. I left just to take on like different opportunities and also as a mom now. But now I'm helping parents and families in kind of the part of illness that happens at home. So, taking medication, coping with going to school, coping with friendships,
Yep.
getting in the bathtub, going to bed, kind of the day to day functioning and the anxiety management in the context of medical illness. So I've now, I went back to school several years ago for counseling. And so now I'm kind of bringing those two professions together, the child life and the counseling, to help people cope beyond the kind of that acute
Yeah.
crisis response. But I wouldn't have, I always say like my time in the hospital definitely makes me a better, independent professional. And I think, also being a child life specialist makes me a better mom, and being a mom makes me a better child life specialist because I can relate differently now too.
Absolutely. Absolutely. Can you tell us a little bit about working with a teenager? I know we talked a little bit about the little ones, but teenagers have their own developmental tasks, right? And often it's being away from home and being away from, parents and separating. So I'm curious kind of how that looks in the context of if they have their own illness.
Yeah, absolutely. And before I do that, actually, I'm thinking, I want to add that everything we've just talked about also applies to like really young kids. Like my 1.5-year-old had a surgery and I was preparing her and showing her like the anesthesia mask. And so, we shouldn't dismiss these infants and toddlers either because they actually know and understand so much and it can really help them. And for teens, yeah, I think the infants and the teens are kind of the two that get missed sometimes. I think not underestimating what a teenager understands. They may have misconceptions as well, and if we don't help them know that it's okay to talk about it with their adults, they may not feel comfortable talking about it. They may talk to their friends about it. They might research and get unhelpful or inaccurate information. So if we can be that walk that path with them and for them. But also the big thing is not forcing teenagers to talk, just being like a consistent supportive presence. I've had teenagers shut the door on me as a therapist and a counselor, and I'm often like, that's fine. Like I'm gonna stay here. Like I'm not giving up on you. So I think just being that consistent, reliable presence. I think parenting teens with chronic illness is so much about trust, just being present, trust, and empowering them, right? It's their body. It's, a lot of times teenagers want to be in the room having discussions, with the doctors, but not overlook that they're still a child and they need their parent. And so it's like that tricky balance of like, you are the patient, this is your body. I'm going to empower you. I want to protect your privacy. And like, you don't have to navigate this alone. I think finding that balance looks a little bit different for teenagers.
Wow. Absolutely. And are there usually in the hospital setting other teenagers? Like, do they do more group work at that age? Because I imagine they would respond well to having more peer support too.
Yeah, yeah. I mean, pre-COVID, we had a teen lounge at the hospital and a playroom, and so we would get kids together and out of the room as much as possible. I mean, I think with virtual, there's a lot more options now to get kids together in different ways because there's also sometimes in the hospital, kids are on like isolation precautions where they can't leave their room, and so that
Right.
can be really isolating. So
Oh,
we've done like virtual proms, we've done, virtual like different ways to engage teenagers, that peer support is huge, for sure. And yeah, there was something else you said, but I lost my train of thought. Maybe it'll come back to me.
No, that's okay. Amazing. Yeah, no, again, I'm hoping we don't have enough people in these situations that it merits it. But I was going to say, do you do any of these things in your private practice in terms of like setting up support groups or networks for families who are struggling?
Yeah, I mean, I try to connect kids and teenagers within my practice with both of their permission if it feels like it would be a helpful
Okay.
connection for both families. I have done groups in the past. I did a chronic illness group for teens, and I did a grief group. I was working on, I see a lot, I haven't talked about it on this yet, but I see a lot of kids impacted by food allergies and
That was my
a lot of
next
kids.
question. Go ahead.
Yeah, a lot of kids that are doing like oral immunotherapy treatment. And so I was working on setting up a peer group for that. It was just hard timing with end of school year, but that's like been a strong
Yeah.
request for, meeting other kids. Like I'm working with a 12-year-old who's going away to summer camp and he has to do his OIT dose and he misses basketball when the kids are all playing basketball because there's a lot of guidelines around taking the dose that people don't really know or understand. They have to hold still or not hold still, but be kind of
Yeah.
inactive for a couple hours. And so camp, there's not a lot of downtime at summer camp. And so, helping kids not feel so alone in that. For Pickles group, we do peer groups. So for kids who have a parent with cancer, we put kids in peer groups, age based. So we have like exclusive teenager groups. And that was actually the thought I had is when a kid has a parent with cancer, they struggle with like trying to be a kid and be a helper. And so I try to help parents, prioritize what's important to those teenagers and not ask too much of them, but also give them a reasonable amount of responsibility so that they do feel involved and helpful. But I think a lot of times the oldest sibling can get like a lot of responsibility. And so we have to be, cautious of finding that balance. But Pickles Group provides that peer group experience for kids who have a parent with cancer. And I would like to do more of that in my private practice for some of these other types of illnesses for sure.
It's incredible. Tell us how you got involved into the food allergy realm.
Yeah, I honestly don't even remember how it started. It just really took off. I mean, there is so
Very
much
common.
misunderstanding. Yeah, it's common and misunderstood. I mean, it makes sense as a child life specialist to work with kids with food allergies. I literally just had skin testing myself last week for environmental allergies. And like, it's so uncomfortable. My arms were like swelling and red and itchy, and I had to hold still. And it's like, this is a procedure. This is a medical procedure. I have that expertise, supporting kids with skin prick tests, their OIT dosing, coping with being, quote unquote, different than the other kids, not understanding a life threatening illness, carrying an EpiPen. Like people just don't understand how much food allergies impacts a child, a family, going to
Yeah.
birthday parties, Halloween, Easter, like all these like holidays that are so food focused and candy focused and sleepovers. And so
Cooking
it makes
labels.
perfect sense. Yeah, yeah. And managing anxiety because I teach a lot of these kids about the physiological anxiety symptoms and how those can look really similar to allergic reactions. My tummy hurts, my throat feels funny. And so helping them distinguish that because they do have a lot of fear. And so
Well,
yeah,
there's
so
a
it's
high
just
correlation between food allergies and anxiety.
absolutely. Yeah. Yeah. And helping parents too, when your child is diagnosed with food allergies so young, it's so scary and you have to figure out how to manage the anxiety and live with the food allergies. It's lifelong. It's chronic. So I don't know. I think there's a food allergy counselor network, which I know you mentioned at the beginning. The name just changed. I think it's like Food Allergy Academy of Counseling or something. But I've been part of that for a while, and so I do get a lot of referrals for food allergies, and there's not a lot of people specializing in that area, especially those who work with young children. So it's just kind of taken off in this niche. And I have a physician I work with who says like it's usually the anxiety that gets in the way of us completing treatment. It's not, actually the reactions or the allergies themselves. So
Right, right. Oh
yeah.
my goodness, absolutely. We had a family member who had to go through that, the dosing treatment. I forget the official name. Say it again.
OIT, oral
OIT.
immunotherapy.
Yes,
Yeah.
yes. But we would
Yeah.
like find creative ways to put what she needed for all these different nuts in, cookie form and smoothie form. But poor kid was so sick of them, sick of this dose.
Yeah, like I'm sure a kid who doesn't have food allergies would be like, "Oh, that's so cool. You get to eat like 10 peanut M&Ms every day." And the kid who has to eat the peanut M&Ms is like, "I hate the smell, I hate the taste. I'm scared of it because I've been told it could kill me and I have to do it every day like
Very
medicine." Like
unpleasant.
it's not fun.
Yeah, no, very
So,
unpleasant. Absolutely.
yeah.
But no, I think again, there's such a need to have more expertise in this area for kids who are struggling with that, for sure.
Yeah.
Sure.
There's a lot of pokes too. I mean, the EpiPens and the, getting blood draws usually annually. And I've seen a lot of patients who come to me after they've had like an anaphylactic experience.
Oh my gosh.
And there's a lot of fear, after that. So,
Of course.
yeah.
No, I mean, it's terrifying for sure. For
Yeah.
sure.
And most kids are they can live really well and be safe with food allergies. But, working in the pediatric ICU, I did see some of the more severe, reactions. And so I think that's another reason why I got into it is because I saw the impact of when it's really severe.
Absolutely. Absolutely. So you've shared a lot of wonderful anecdotes and kind of like stories to help us understand how you use your expertise and also your workbook across sort of the lifespan. I was going to ask if there are any other stories or kind of anecdotes that you wanted to share or any other kind of helpful advice.
Um, oh, it's a good question. I think that um, I in counseling, they don't really cover a lot about illness or grief. And in child life, we don't necessarily cover a lot about, traditional counseling and like mental health diagnoses and treatments. And so being able to bring those two things together, and there are so many incredible therapists in practice like yourself that are supporting kids and teens, struggling with mental health or anxiety, depression. And so to be able to kind of be in this niche space where like if I get a call for traditional anxiety, I'm often like, there are so many wonderful people who can treat that. Like I want to really focus on these medical illnesses and grief because it's really a specialty and it's not something that everybody understands. And when a parent calls me and they don't have to explain, what a PIC line is or what meds their kid is on, like it's such a relief to not have to share their whole story. My kid has had 27 surgeries, and I'm like, yep, I know exactly what that is. Like it's just a different experience. And so I'm really glad that I've been able to just um, specialize and help people that are really in this unique, it's like situational. Like they might not have challenges with anxiety had they not had the chronic illness or the grief. So I
Right.
talk a lot about it's not really like a pathology to fix or change. It's more like a situation to respond to and to support. And so I just approach it a little bit differently.
Absolutely. Absolutely. You've shared a lot of resources with us, including your own workbook, Pickles being one. Any other really helpful podcasts or books or resources for anyone struggling with cancer, again, childhood cancer or a parent who has cancer?
Yeah, I mean there are several out there. On the Pickles Group website, I do oversee like a resources page, and so I try to update that with different organizations and books and things like that, both for end of life and for cancer. And so that's a great place to look. And yeah, I mean, I Pickles Group works a lot with like Bright Spot Network and Kesem and Wonders and Worries for like the parent illness piece. And Dragonfly Foundation in Chicago and Ohio is a pediatric cancer. That's the organization that has funded the DOT method for all the Chicago pediatric oncology centers. So I'm really grateful to them, and they do a lot of wonderful supportive work for pediatric cancer in the Chicagoland area. But that probably is just scratching the surface. There's a
No,
lot of great resources.
that's super helpful. Well, thank you so much, Kelsey, for your time and expertise. I want to share your website with everyone, which is childlifetherapist.com. And you can also reach Kelsey at Kelsey, Kelsey, at childlifetherapist.com. You can also buy her workbook, which is here, The DOT Method, an interactive tool to teach kids about cancer on Amazon. And everyone, please check out more episodes of our podcast. Go to copingpartners.com and click on podcast and articles. And thank you, as always, for tuning in. And thank you, Kelsey, for being here.
Thank you. Thank you for having me. Thank you, everyone, for listening.
Thank you for listening to the Coping Podcast. We'll see you again next time, and be sure to click subscribe to get future episodes. And check out our podcast page at copingpartners.com.